Hey guys, AUDHD here, and now I want to dive deep into this video straight away about what life is like being diagnosed late with ADHD and autism, or as it's now more commonly called, AUDHD. Right, Jordan? Never mind him. Now, first and foremost, you might ask, what was the lead up like to being diagnosed with ADHD and autism late? Well, not a very good one, shall we say. Now, I'm from the UK, as you may have noticed from my quite broad Yorkshire accent, which I still find terrible for YouTube, but anyway. The first step started with the stereotypical school reports of talks too much and could apply himself better. And I had to learn to suppress myself along the way whilst being younger, but that's for another video. Jumping forward to around 19 years old after being in education and entering my first job, I knew something just wasn't quite right anymore. So I decided to take my first step into the GP and finally try and explain what was going on with me, which the famous label of anxiety first occurred. Now, let me make this apparent that I always felt like I was the black sheep of the family, not in a way of a emo, ooh, let me sit in the corner kind of way, but I always put it down to the obvious age gap within the family and being the youngest. But after seeing others clear hurdles whilst I was dragging my feet, I felt like it was time to actually finally get some help. I still hadn't much idea of what ADHD or autism even was, to be quite honest. ADHD was not even a term that I'd even heard of, neither had neurodivergent, which apparently, according to Wikipedia, it first was used in 1998 by an American journalist called Harvey Bloom. Now, as already stated, to try and cut a long story short, the GP did just tell me it was anxiety, so I tried to step away, moving backwards within the story, get through college, an apprenticeship, and then try and move on to try and get a job, which, surprise surprise, I quite failed at the job part. But I did finally manage to get into work, and that's only when the symptoms and the reality of it all started to get worse. The job that I did end up securing was absolutely nothing to do what I even did in college and my apprenticeship, and to be quite honest, I failed pretty miserably at college as well, as to say I did average at best at school. And it was in the dreaded retail sector, which now looking back, to be quite honest, I have no idea how I managed to push through it, as the current version of me is suffering with burnout on a constant basis, and day-to-day tasks are becoming more and more energy consuming. It was quite ironic because, to be honest, I ended up slowly moving on to doing deliveries whilst I was at work, so I could work alone at 2 o'clock in the morning. Yay me! Slowly didn't realise that I was trying to avoid every social situation that I encountered. Unfortunately for me, the symptoms didn't subside. In fact, if anything, they got worse. Now, understanding that autism and ADHD is a spectrum, you may be saying, how could they have got worse? Technically, they should always stay on the same keel. Well, this is where I think the comorbidity of anxiety and depression enter the chat. So, off to the GP I went with another appointment about a year later, where the word anxiety crept up again, and I was prescribed my first, not knowing as many, antidepressants, which, let's just say, have taken their toll over the years. Now, at first, they did seem to ease the nerves a little bit, and I walked away like the idiot I was at the time and thought, yay, the GP has solved the issue for me. Until, oh wait, the lights are still hurting my eyes, the noise is still hurting my ears and causing more migraines to occur. I'm struggling to manage to do 25 hours a week whilst trying to manage a life of wanting a girlfriend, a car, to try and afford to move out, etc, until... yes. Breakdown occurred. I always wanted to try and keep up in my Vauxhall Nova whilst everybody else was driving around in a 3-litre. I went back to the GP where they decided to increase my medication again, and that's when the side effects started occurring. To save you all about 20 minutes of going through my life for the next 10 years, it was literally a cycle of going through different antidepressants, going through CBT around 4 times, as well as paying for private therapy, and just constantly thinking I was a broken mess. On top of that, my migraines finally got to the point where I couldn't take them anymore, and around the age of 25, 26, I also started taking medication for migraines as well, where I have now been through a number of migraine medications too. It wasn't until around the middle of 2023 that I entered the GP once again, thinking I was just going to be changing or maybe increasing my medication again, until I saw a different GP and the statement, "You may have ADHD," popped up. Honestly, at the time, my overthinking brain just went straight home and started reading up all about ADHD, and it seems like just the jigsaw piece just started to fit that was missing for all these years. Struggling to start and stop tasks? Tick. Losing things around the house on a regular basis? Tick. Feeling restless and sometimes can't shut up to the point of verbal diarrhea? Tick. On top of this, there was the sleep issues, as well as the shortening attention span, and the comorbidities entering the chat of anxiety, depression, migraines, as well as many other things I can discuss within another video. And throughout all of this, the good old dopamine seeking of the impulses started to become worse and worse as well, as I believe just because as an adult, especially when you're working, you start having your own money. Now, usually having your own money is a good thing, but for me, it just started showing the obvious signs of where the impulses were really bad at times. This, for the first time, actually felt like I was getting somewhere, so I printed out the ADHD diagnostic sheet, or I got it from the doctors, to be quite honest, I can't remember at this point. Filled it out, pretty much got near enough the 12 out of 12 to some extent, whether it might have been 10 or 11, filling out different sometimes, every so often kind of situation. I can't remember what's on that form. You will if you're going through the process or recently have. But basically, most of the things are from don't do at all to do all the time. I handed this into the GP for them to put through the referral, and about 4 weeks later, I got refused by the NHS referral. Looking at what to do next, to be quite honest, I came over the concept of right to choose, which, if anybody isn't aware, is basically a private service which runs under the NHS, where you as a patient can ask for a referral there under the right to choose service. The referral will be taken up by the GP, and then the private firm will take on the NHS's jobs of basically managing what they can't manage at this point because of being overwhelmed in the system. I went through the right to choose system with the company called Psychiatry UK, which many of you who have been through this process within the UK would probably be quite aware of by now. But the referral actually got accepted. Just one problem. I had to wait another year to be assessed. Coincidentally, whilst this was happening, my 3-year-old son at the time was showing signs of development issues as well as symptoms of autism, which we became aware of thanks to my partner, now wife, from her reading about it just alongside the ADHD symptoms, as well as her having a relative with autism herself. Between the times of me waiting for my assessment, we thankfully managed to get our son diagnosed with autism, and he was put on a spiky level, whichever that's supposed to mean. Basically, he did have a development cycle which was about 2 years difference, but academically he was actually doing pretty good, despite his speech actually being delayed. That's when I realised that he shared a lot of traits similar to myself when I was younger, and as he got older as well. Thankfully, which I will be covering in a different video, as son didn't have to wait and go through the assessment process that I had to, which took more years. For our son, thankfully, it took only months. Grateful that we live in an area where thankfully they got him through the process pretty quickly. It was also at the time that I started to realise that he shared quite a few similar traits to myself when he was younger, as well as he's gradually got older at the age of 6 now. Stimming, struggling with loud noises, standing still and fidgeting, trying to get him to prompt him to do tasks, as well as constant supervision, echolalia, and needing to make sure that he didn't just run out the front door, which once he did actually attempt. And as he's gotten older, roughly around the same age as me, which was 5 or 6 years old, he has now started with the traits that I believe to be tics. Now, I want to just make this clarification, I have not been diagnosed with them, neither has my son, but I do believe how they are presented that they are tics, or some form of Tourette's. I've had these since I was 6 years old, and at the age of 32 they have only just changed, got better and worse, and I do believe that anxiety is a big exacerbator of them as well. This might sound strange to some people, but for me, I just struggle to attach myself to saying that I have tics, even though I've just stated it, but basically to say I have it despite not having a diagnosis, because for me, I don't want to try and go down the self-diagnosis route. I'm just trying to help myself the best way I can. Thankfully, I have a referral going forward to the neurologist at this point, just to try and get some help, what I believe to be the tics, and hopefully migraines as well. As the 12 months were passing, I did actually put forward a assessment referral as well for autism, and believe it or not, this one actually got accepted by the NHS, but Their wait times was 2.5 years within my area, and I'm well aware that these assessment waiting times can be much higher in other areas too. I was actually able to go down the route of Psychiatry UK with this as well, and their wait time at the time was around only 3 or 4 months, which is incredibly shorter and a big difference compared to the NHS. So, after rambling all this time about my assessments and referrals, where did I end up at the end of 2024? Well, I actually got married, believe it or not. I got my diagnosis of ADHD combined as well as autism level 1. I think between all of this as well as having gastroenteritis at the end of 2023, I also ended up losing 3 stone in weight, which can lead into IBS, another comorbidity of ADHD which can be a separate video in itself. But for it all, I've done it! I've got my answer! I finally know where I stand. Although, the problem is, I'm burnt out, always tired, fatigued. Migraines are still just as bad as ever. And if anything, I've been left with the trails of my past, always struggling. So, do I think the GP actually diagnosed me right when I first entered those doors back when I was 19 years old? Actually, yes, I do. I still believe I suffer with anxiety disorder to this day, as well as I did all those years ago. On top of this, I have suffered past trauma, which I understand some of the symptoms can come through as PTSD instead of ADHD or autism, but I did have quite a past from being 5-6 years old to look back on and realise where the symptoms of ADHD and autism started for myself. And for me, anxiety just never summed up what I was going through. Other people had said they'd gone through anxiety, been able to take antidepressants, take CBT, get better. Why did that not happen for me? Well, I think that just summed up going back from when I was a child. Why life always felt like everything was an obstacle to me. Why I just didn't see the same way as everybody else. Why the picture always was black and white and struggled with the grey area. And why for the 4th time I attempted to try and read a book and just couldn't finish. Why I had my mum shouting at me when I was at school for ruining another pair of shoes because I was too busy swinging off my chair and digging them into the back of the legs all the time. My fault, sorry mum. And even at the age of about 6 or 7 years old when I was in infants, shoving my hand behind a radiator and getting it stuck. Thankfully the teacher at the time had a screwdriver to hand for some reason and managed to set me free. Otherwise it might have been a fire brigade job. Yes, I got bored at carpet time whilst they was reading books. Thankfully I haven't seen anyone from that incident probably in the past 20 years, so most people will have forgot. Except for the internet now. Let me just say the past 12-13 years since becoming an adult has become a real challenge, and now at the age of 32 I'm still facing some of the same challenges. I'm awaiting titration through the ADHD diagnosis. I'm now waiting for the neurologist for a referral with those. Everything is a constant wait, everything a constant grind, and unfortunately this just won't go away. Not unless the ADHD medication makes a big difference for me, which until I try it I don't know. Getting further help for my mental health, trying to see more therapists, trying to see if there's anywhere that can alleviate that side, and believe it or not, try and be a little bit more selfish. Through the years I've tried myself to always be a people pleaser, and it's kind of kicked me back in the teeth as I've gotten older. And more importantly, my family. Baby number 2 is on the way, and I want to make sure that I am in the best shape possible, despite always facing challenges, being a carer, and having my own health problems, of being the best dad I can be. My family has been a rock in the hard places that I have been throughout this journey, if you want to call it journey, timeline, etc. And to be quite honest, I do not know where I'd be without them at this point. My wife, as well as my child, as well as child number 2 being on the way, have been my save and grace at the times. Give me something to get out of bed for, because to be quite honest with you, sometimes it has been a real fight, but they always gave me a reason to get up and keep fighting. Some days I don't want to be here, some days I don't exist, some days I struggle so much with society that I just want to lock myself in the bedroom. But thankfully my family are the ones who always keep me close, help me through those journeys, and I'm more than grateful for the way they'll never understand for all of this. But I do know this: if you've ever struggled through life, if you've always felt like the black sheep, if you have always felt that something just isn't right, the missing jigsaw piece, you just can't find it, well, maybe if some of these symptoms of neurodivergence fits you, maybe it's your time to go to the GP. Your time to go and seek a diagnosis. Your time to finally get on track to understand who the real you is. Thanks for watching.
So if you enjoyed this video and want to follow future content, then feel free to subscribe and like this video, and tell me in the comments section if you've had a late diagnosis and what it's done for you. And again, thanks for watching.